Weather, we're still looking at some
Tonight, News Channel 11 is in your corner asking the top executive of Ballad Health questions you want answered regarding the recent changes to Tri-Cities trauma centers and the pediatric NICU unit in Kingsport. With that, we welcome you into News Channel 11 at 5:30. I'm Sarah Diamond. Last week, Ballad Health announced changes in the Tri-Cities regarding trauma centers. Holston Valley Medical Center in Kingsport is currently a level 1 trauma center. It will become a level 3. Bristol Regional Medical Center is currently at a level 2 trauma center. It will also become a level 3. Johnson City Medical Center will maintain its status as a level 1 trauma center. Some other important changes: pediatric emergency rooms will be added to Holston Valley and Bristol, while the first pediatric trauma center in the region will be added at Johnson City Medical Center. Ballad Health CEO Alan Levine joins us tonight in the studio with Josh to talk about all of these changes and explain why they're happening. Josh?
Sarah, thank you very much, and thank you, Alan Levine, for being here in an extended time. We're going to take a moment to go a little deeper than we've been able to go on an issue that's been of big conversation throughout the region over the past few days. So thank you for your time ahead tonight.
It's good to be with you.
We'll probably cover some ground off the top that you've already covered, but these seem to be points of concern that some people have had about the movement, it seems, of trauma intensivity, and maybe that's the wrong word, the intensive trauma care, out of Sullivan County to Johnson City, when some people say Kingsport maybe is even more central for our overall geographic region. Why move to Johnson City what's in Kingsport and Bristol?
Well, most of the trauma is going to stay in either Holston Valley or at Bristol. 65% of the trauma is orthopedic, 20% is neurosurgery, and we're going to continue to provide those services there. So most trauma is going to stay at Holston Valley or at Bristol. So what we're really talking about, there was only 380 major trauma cases between Johnson City and Kingsport last year. And that's an objective metric. Major trauma is coded by doctors. And of that major trauma, 150 cases were at Holston Valley, and 220 cases were at Johnson City Medical Center. So about 60% of the major trauma today is provided at Johnson City Medical Center. So we're really only talking about basically about 150 to 200 major trauma cases. All of the national evidence, all of the recommendations from virtually every expert says major trauma that's consolidated in one institution has better outcomes. And I would encourage people to read about that, because it's very important. We're talking about the most major trauma cases. If you're in a car accident, or if you fall, if you have a hip fracture or something like that, you're still going to be able to get your care at the closest hospital to you. And that's something that's very important. I want to reiterate, most injuries are going to continue to be treated where they're treated today. And I should also add, heart attacks, strokes, other types of regular emergencies that are serious, you can still go to your local emergency department. That's not considered trauma.
Alan, right after this decision was announced Wednesday, the Sullivan County Commission met Thursday and passed a resolution opposing this measure, which you know about. One of the commissioners told us this change in trauma services, he said, lives will be lost. I think the mortality rate will go up. I think the death rate will rise in Sullivan County. Is that mistaken? Is that incorrect, or is that true?
Well, first of all, I appreciate the partnership we have with the Sullivan County Commission. I look forward to actually meeting with them. They don't have the information that we have, and so I think once they have it, I think their opinion will be different. To the contrary, more lives will be saved. This will improve the outcomes for people, because the evidence shows major trauma should not be diluted into two lower volume centers. It should be done at a place where you have more volume, more consistency, more consistent coverage of doctors and staff. So it's the right thing to do. I think all of the evidence points to the fact that this will improve the care and the outcomes for people. Now, if that commissioner that said that has evidence to the contrary, we would certainly want to hear that. But so far, we've seen no evidence to the contrary. Keep in mind that this decision was not just made, I didn't actually make this decision. We had a committee of physicians, including trauma surgeons, general surgeons, the former president of the Tennessee Medical Association. Doctors contributed to this decision. And then our board made the ultimate decision. So,
but you talk about the information that they didn't have. The commissioners passed the resolution and in essence said they were blindsided, that they had not been brought into the discussion. They found out when the announcement was made. Is that true? Was there no discussion with local leaders about this plan to realign trauma?
Well, our board made a decision Monday, and we did reach out to several elected folks in Kingsport and at least one of the leaders on the county commission in Sullivan County. There wasn't enough time to get to all of them individually. There's 24 of them. But what we said at the press conference on Wednesday was, we're announcing what our intentions are for the trauma centers. Now, this begins a one-year process of working with local governments to put together a regional trauma system. A big part of this is, you know, we have patients that go to some of our rural hospitals throughout the region, and they can wait hours before being transferred because of the unavailability of ambulances. There's a need to create more coordination between all of our counties with pre-hospital transport. That's why we've offered to spend money to create a pre-hospital communication system so that, for instance, if there's an ambulance in a rural community that needs to transport a patient, by communicating with us, we can coordinate with other EMS services and then provide coverage for that ambulance while they're traveling. But this, you have to start with announcing what our vision is, then you start meeting with the county commissions and everybody else to reach agreement on what that system should look like.
Another topic that has generated some questions has been the realignment of neonatal intensive care. We're going to take a brief break and come back. Our discussion with Alan Levine about changes with the Ballad Health merger continue right after this.
News Channel 11 in your corner. 65 years and counting. The first to dig deeper.
You will not know unless you taste.
Some of the highest levels of radon in the country are right here.
The best investigations.
Tri-Cities region is one of the areas hit hardest by the opioid abuse epidemic.
How many
years.
And we welcome you back to News Channel 11 at 5:30. We're continuing to discuss live in studio Alan Levine, the president, chairman, CEO of Ballad Health. We're discussing with him proposed changes to the trauma care system and also the neonatal intensive care system, the care for the most vulnerable of newborn babies. And I'd love to start here. the announcement was made that the NICU at Holston Valley Medical Center, that's been there for decades, is going to be transferred over to the Niswonger Children's Hospital, where you have a very large NICU with a larger staff. Now there's a petition. I don't know if you've seen this. It's online. It was close to 16,000 signatures of people who simply are saying, save the NICU at Holston Valley and Kingsport. What's your response to that?
Well, first of all, I appreciate people's passion, and they should be passionate. These are our most vulnerable children. There's no group of people more passionate about taking care of the people in this region, particularly our children, than our board of directors. They live here, they grew up here, they have grandkids here, there's doctors, and so while I appreciate everybody's passion, people also have to respect the fact that the board has gone through a very meticulous process of looking at the research, the evidence, and what's best for these children. The state of Tennessee law and the policy of the Department of Health in Tennessee is to have 5 regional perinatal centers that are high volume, deal with the sickest of children. And virtually every study, every evidence-based research, the American Academy of Pediatricians, they all say the same thing. You should have high-risk newborns in a NICU that has a volume generally of more than 15 patients. The average daily census at Holston Valley is 7. The average daily census at Niswonger Children's Hospital is 29. Niswonger Children's Hospital is an advanced certified perinatology center. I appreciate the good work that everybody does at Holston Valley in the NICU. They're great people, they're heroes, and we want them to stay. But we have to follow the evidence, and it's really important that we don't lose sight of that. This is about the patients, the children, and the moms. It's not about institutions and what we just want. We have to follow what the evidence says.
I want to cover some more ground while I have you here. On social media through the weekend, a flurry of discussions. I saw more than once the insinuation that Ballad employees were being discouraged from sharing their concerns, or even could face consequences from sharing their concerns. And I want to give you a chance to address that directly. Are Ballad employees welcome to join the discussion on this?
Absolutely, and
how?
I communicate with Ballad employees directly. Some of them hit me on Twitter. I have a Twitter account, Levine014, and I try to be accessible to everybody. Now, it's important when you are a Ballad Health employee and you represent yourself to be a Ballad Health employee, that what you say publicly is accurate. If you say something that's not accurate, particularly if it inflames the public with information that's not true or not supported by the evidence, that's a serious problem. People shouldn't do that. And people have been advised, be factual with what you say. You know, nurses and people who care for patients, they have a responsibility to advocate for their patients. My wife's a nurse. She's a great advocate. I would never discourage anybody from doing anything other than always advocate what's best for patients. But I'm very directly accessible, and people can, whether you support what I'm doing or not, whether you agree with it or not, I'll engage with you if you want to talk to me about the facts and the evidence and have a real reasonable dialogue about it. I know it's gotten a little bit passionate and heated. I don't know. That that's helpful. I think what's helpful is a discussion about what's best for the children.
There's a petition. There are resolutions. It seems there is hope by some that maybe somehow they could affect change or maybe someone would reconsider a decision. Is there any hope that any of what has been announced could be reconsidered and changed because of the reaction?
Our board is committed to this decision because it follows the evidence. Anything other than following the evidence, particularly when it comes to the highest risk newborns, is not something the board's interested in doing. You know, the reality is, think about this. I know that one of the complaints people have is the distance of travel. More than 500 newborns, high-risk newborns were transferred from Niswonger in the last 24 months from areas in Virginia, Hawkins County, Wise County, Dickinson, Smith County. Some traveled over 2 hours away. Most of the transfers of newborns from Holston Valley actually were transferred in the last 2 years to Knoxville and to Nashville and to Charlottesville, Virginia. So I think a lot of issues are being brought up that are not based on fact. The reality is a high-risk newborn child needs to be in the region's perinatal center that's designated by the state, that has the 25 pediatric subspecialties available, which they don't have at Holston Valley. That's where I would want my newborn. And you know, the CEO of Niswonger Children's Hospital, her own child was a premature child that was served in the NICU there. These are people that care deeply about caring for children in our region. Our board is following the evidence here, and I think most people should be very proud of the process that the board went through. And I think over the next few weeks we'll have a chance to explain this to people, share the facts and share the data. And I think when people step back and look at the data objectively, they'll see that the board absolutely made the right decision.
We'll have to leave it there. Alan Levine, President and CEO of Ballad Health, thank you for your time. We appreciate it. And the news at 5:30 continues in a moment.
You don't have to wait for the day after Thanksgiving for the best deals. Get those savings all month long at #1 Wallace Subaru in Johnson City. Shop till you drop with the Tri-City's largest Subaru selection. And check out the totally redesigned 2019 Forester and the all-new 7-passenger Ascent. Stay warm in Tennessee's largest Subaru showroom and shop the 2018 Crosstrek as low as $179 a month. Plus, during the Subaru Share the Love event, Subaru will donate $250 to selected national or hometown charities with every new Subaru sold or leased. Now more than ever.